Hey, hi everyone. We are on to Unit 2, which will be our aerobic metabolism. So we've previously talked about anaerobic metabolism, how we have those first two sort of short-term and intermediate energy systems. And this unit is going to focus on aerobic metabolism, so that third use of energy. So before we get into some of the more complicated concepts for aerobic metabolism, I wanted to introduce the concept of VO2 max and submax testing. Now, if you are enrolled in lab concurrently with this class, you will hear more about this. And if you're not in lab, then I'm excited to take a few minutes and explain what an important concept and testing this is in the exercise physiology world. So this module will cover what VO2 max is, how it's measured, what are the types of apparatuses you can use to measure this, and then the difference between submax and max testing. So again, we have our sort of three energy systems. Remember, for our anaerobic energy systems, we have the ATP-PC system. The second one is our glycolytic lactic acid system. And then this unit is going to cover this aerobic energy system. So those lasting more than 3 minutes up to hours of activity. So sort of think of long, slow duration activities. So another way to look at this, again, is showing that our ATP-PC system lasts up to 10 seconds. Our lactic acid system is 2 to 3 minutes. And then this aerobic oxidative phosphorylation energy system is 3 minutes to an hour. So let's go ahead and take a look at this graph here on the left-hand side. So again, remember to always orient yourself. So we have maximal exercise duration, so 30 minutes. So if we're above this 2-minute line, we know that this is aerobic. And then we have the total energy consumption on our y-axis. So we know that anaerobic exercise really dips at that 3-minute mark and doesn't contribute to our maximal exercise duration energy use. However, a person running a 5K in about 20 minutes, which is pretty good, uses about 95% of his or her energy via aerobic metabolism. So this aerobic metabolism is what this new unit will focus on. But again, today we're talking about VO2 max test and submax testing. So the American College of Sports Medicine, that's sort of our governing body of exercise physiologists and all things in the exercise world. So they define aerobic exercise as any activity that uses large muscle groups. They can be maintained continuously and is rhythmic in nature. So as the name implies, we are really using muscle groups that are activated by this type of exercise that rely on aerobic metabolism to extract energy from ATP. So we're really going to dive into these concepts in Unit 2. So aerobic exercise can be best accessed via the aerobic capacity, which is defined as the product of the capacity of the cardiorespiratory system to supply oxygen and the capacity of the skeletal muscles to utilize oxygen. So the reason why this is in red is this is a really important concept to kind of work out in your brains. So cardiorespiratory system to supply oxygen. So we're supplying oxygen to the skeletal muscles to utilize that oxygen to carry out activity, or in this case, to carry out aerobic metabolism. So the way that we as exercise physiologists measure this is through a graded exercise or treadmill protocol. Ergometry, this means a bike. So we either do it on a bike or a treadmill. So a fun question, what is the highest VO2 max ever recorded for a male and for a female, and what sport do you think that is? I know we haven't really talked about numbers associated with VO2 max, but for a male, we can get up to about a 90 VO2 max, and a female is about 85. And what sport? Really, it's very known that cross-country skiers are the most aerobically fit out of all of the aerobic endurance athletes. Now, that's just generalizing. Of course, we have amazing cyclists and swimmers and runners, but cross-country skiing tends to put out athletes that have really high VO2 max tests. So this is sort of a still image from the VO2 max video, a YouTube video you should have watched prior to listening to this lecture. So I'm not going to go into a lot of detail of what's going on here, but we essentially have our metabolic cart. And this analyzes the gas exchange that allows us to be able to accurately get a VO2 max test. So we are testing maximal oxygen consumption that your body is able to take in and utilize and deliver that oxygen to the working skeletal muscles to carry out aerobic metabolism. So please make sure you watch that video. It's just a couple minutes long, but I think it gives a really good insight into one of the main kind of tests as exercise physiologists that we do. So let's go ahead and break down what VO2 max means. So the V is volume, the O2 is oxygen, and the max is maximal or maximum. So essentially, when we talk about VO2 max in the exercise world, we are talking about the maximal volume of oxygen your body can utilize. And so this is just a really great tool, again, like kind of the DEXA looking at body composition, to do a VO2 max maybe pre or post an exercise training plan so you can see how much you've improved, how much better your body is at utilizing oxygen to fuel skeletal muscle work to get you through that certain activity. So what is VO2 max and how do we record it? This is just sort of another way to explain it, but we have aerobic capacity, which is the maximum oxygen the body can utilize. Cardiac output, we'll talk about this in our final unit, but that's the max oxygen that the heart can supply. We know that cardiac output equals stroke volume times heart rate. And then we also have muscle pumps in our soleus and our gastroc, and in that kind of hind limb, those muscles at the bottom and the back of your leg. And this is our muscle oxygen uptake. So the maximal oxygen that muscles can burn and utilize to get you through that activity. So again, VO2 max is the maximal oxygen the body can utilize. It's like the engine size of the human body. So it really is that true physiological test to show you how well your body utilizes oxygen. So this is a scale of VO2 max here, showing elite men in this particular example. So has anyone ever heard of ADL? That means activities of daily living. So on the clinical side of things, when we talk about activities of daily living, particularly, it doesn't have to be, but usually it's with our older patients, you need to have a VO2 max of about 20 just to do simple tasks like go to the bathroom, walk to the sink to brush your teeth, get in and out of bed. So having a VO2 max of 20, you really wouldn't want to max these patients, but of about 20 means that you are able to kind of just sustain that, I don't want to say lower level of life, but that's kind of what I'm getting at for our activities of daily living. Then if you have a VO2 of around 30, you're at low risk, but you really are kind of towing the line there if you have cardiovascular disease or any sort of underlying conditions. When you get into the 40s and the 50s, that's probably where a lot of us are. If you're in Laramie, our VO2 max will actually be a little bit less because of the altitude component, and we'll talk about that as well. But in the 40s and 50s is really where our VO2 max should be. Pro athletes are in the 60s and 70s. And then again, we can get up to about 90 or so for some of our elite cross-country skiers. So this is just to give you a little bit of an idea of our VO2 max numbers and benchmarks for certain activities. So there are several ways to test this. The video that you watched prior to this lecture obviously showed you the treadmill. You can also do the bike as well. I am a runner, so my VO2 max on the treadmill will be higher than it will on the bike. I don't like the bike. I'm not very good at cycling. So if you were to put me on a bike, I would do fine because I'm stubborn and I'm an athlete and I would do a good job. But I'm a runner, so running is a more natural movement to me than the bike. So if you're testing your athletes, you really kind of want to see what they're most familiar with and maybe what they'll do the best on. And that's really what you should do, or, just what your setup is in your lab. But these laboratory tests on the bikes or the treadmills, they're accurate. They have standard conditions. You don't have to worry about outside. We have portable, I was a tester for this many years ago, a portable VO2 max, kind of like a backpack where you could run around a track and you had a backpack, but you were still sort of breathing in, and you kind of had the metabolic chamber, though much smaller, on your back. And so the field is trying to validate and kind of get a reliable measure for those, because when you're on a treadmill and you have all of these things hooked up and you're trying to sprint and run really fast, you have all these wires, and it's really kind of claustrophobic and annoying. So if you can be outside and kind of mimic more outdoor conditions, sometimes people do better with that. So you really need to have skill to operate the test. So the clinician that's operating the test has to make sure that the metabolic cart is validated and that it's reliable and that it's calibrated, and then it's going to actually show you the correct numbers. And they're also expensive, right? So a lot of these tools that we have to test these things are not cheap. So there are different ways, again, through graded exercise testing protocols. You can either do a submax or a max test. Now, a max test you would do on a younger, healthier, athletic population. A submax test you would do on an older or maybe more unhealthy population. I would do a submax test on clinical patients, right? So those that maybe have underlying heart disease. The max tests are difficult. You kind of have to have that athletic mentality of like, I'm going to sprint up this hill and I'm going to do a great job. And the clinical population might not have that for a lot of reasons. So there are ways that you can adjust these maximal training protocols that are testing protocols that you wouldn't do on a clinical population. So that's why this says it should be based on the population that you're testing. So are you testing an athlete, a cardiac patient, a child, you would do a sub-max test, depending on the age again. And so test protocols vary, and they are different depending on what facility you're at or where you're at in your training or where you're at in your heart disease. And so test protocols vary in terms of this initial work rate, how large the increment is between each stage, and then the duration of each stage. So it's really important for the clinician to know who they're testing so that the test can run as smoothly and be as accurate as possible. So again, there's a lot of professionals involved. You usually have a registered nurse. Whenever you perform these tests, you have to have a medical doctor, not necessarily on site, but within 5 minutes. So I know here at the University of Wyoming, anytime we do a VO2 max test, we have to let a physician know, hey, we're running some max tests from 5 p.m. to 7 p.m. So they're kind of on call if any issues arise. It's very low risk. There shouldn't be any issues, but you never know. You obviously have an exercise physiologist and our metabolic cart. So this is just sort of a depiction of everything that's involved whenever you do a VO2 max test. So this is an example of different ramp tests. And when we say ramp, we mean running at a certain speed and incline, being there for a few minutes, and then upping that, upping your speed, upping your incline, staying there to get to steady state for a few minutes, and then upping this until you get to about 10 minutes. So for a VO2 all-out max test, 10 minutes is really where you want to aim. If you have a test that lasts much longer than 10 minutes, you probably didn't start at a high enough initial work rate. If you have an individual that sort of gives up, or not gives up, but really is at their max at 4 minutes, you started that test way too hard. So it's kind of a balancing act, and it's really important to start these tests correctly so that you can get an accurate VO2 max number at about that 10-minute mark. So the Bruce protocol is very common, and it's sort of the standard protocol that we use for estimating VO2 max. And I'm not going to go through this, but again, if you're in lab, you'll see this a little bit in more detail, but I wanted to at least mention it. So this is yours truly back in the day, 2009, when I was in graduate school getting my master's in clinical exercise physiology. And this is my VO2 max test. It kind of printed a little bit weird, but I'm going to take you through this, not step by step, but first thing, we have our time. It took me about 16 minutes to get through this test. That's a few minutes too long, but nevertheless, I still actually got a pretty decent VO2 max, and VO2 in kgs, mLs per mg per kg. I had about a 51, which if we look back at our scale, that's right in that athlete zone. I'm kidding. I'm reliving my glory days, but I was pretty decent back then. So my VO2 max was about 51. Some of these other kind of letters and numbers up here, we're going to talk about throughout this unit. So I don't want to overload you with a lot of, I guess, useless information before we've really set the groundwork here. But RER is something that we're going to come back to, respiratory exchange ratio. My heartbeat actually wasn't registering. Good thing we probably had another way to track that. But this is just an example, and this is really what it looks like even, 13 or so years later, for our printouts for our VO2 max. So just wanted to kind of show you what it looked like, and we'll go through some of this terminology as we get through this unit. So again, I said that the submaximal tests are really used for those individuals that are not able to get to that maximal exertion. So this was just sort of a kind of quick crash course in what VO2 max is, how it's measured, and I think it's a really good introduction to what we're going to continue to get into in this unit on aerobic metabolism. So thanks for listening, and I'll see you at the next one.